Recording in progress.
Well, good afternoon, everyone. I want to welcome you all to this Los Animas County Board of Commissioners, acting in capacity as the Board of Human Services. Today is Tuesday, June 17, 2025. It is now 1 p.m. I'm going to call this meeting to order. Please rise for the invocation by Commissioner Lucero.
Heavenly Father, thank you for your faithfulness and provisions in our lives. Thank you for each person in this meeting and the unique talents and perspectives you bring. We thank you for the opportunity to gather together and work toward a common goal. In Jesus' name, amen.
Amen. Please join me on the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And I extend regards from Commissioner Tony Haas. He's attending a meeting in conjunction with the Department of Local Affairs, and it's very important that he attends that meeting, so he will be absent from this meeting. Mr. Aragon, do you please do roll call?
Certainly. Commissioner Lucero?
Yes.
Commissioner Lopez?
Here.
Commissioner Haas is absent today.
Yes, thank you. Approval of the agenda. Do you have any changes to the agenda, Mr. Aragon?
Commissioner, yes. What I would ask is that we remove item 2A, the May 2025 minutes, and I will update the board with both those and the June minutes at the July meeting.
Thank you, sir. On that note, I make a motion to approve the agenda with that change.
Second it?
Commissioner Lopez?
Yes.
Commissioner Lucero?
Yes.
And at this time, I'm going to invite anyone that would like to use this section of the meeting for public comment. Anyone online or here, simply unmute yourself, raise your hand, and you'll have 3 minutes to address this board. Hearing that, I'm going to go to the next section, Director's Report. Mr. Aragon, good afternoon. Thank you and welcome to you and your team from BHS.
Thank you, Commissioner. Just a few items to go over, and as I'm sure you were aware, this was a very heavy packet this month. In fact, I informed Commissioner Lucero prior to the meeting that I had a federal SNAP update this morning, which was an additional 120 pages that you did not get. So if you're looking for some light reading, I'll be glad to forward that review to you. But I'm going to spend some time today just doing a very high-level overview of the federal updates and where that information is coming from. In addition to that, to start off with, I just wanted to thank you, Commissioner Lopez, and since Commissioner Haas is not here, but also Commissioner Lucero, all three of you for attending the Opioid Use Disorder Summit that we offered at the end of May last month. I think it was a very well-attended event. It was 2 days of a lot of information. I know a lot of people left with their head a little more scrambled, but I think the responses on the event were positive in many fashions. Just a few things that we're going to tweak for any future offerings that we do. But outside of that, I think it was just a really great event with a lot of good presentations. And we have posted those links on our website, so folks that are interested in reviewing those, they're broken down by session, so they're free to view, and I hope that people use those as a resource for learning.
Well, thank you. By the way, fantastic roundtable. I mean, it was absolutely well done. We had an opportunity last Tuesday, when was it, Thursday, to go to Pueblo. We had a press release on the opioid, and of course I was going to mention something that we held here in San Luis County, and some of the attendees at the press conference in Pueblo were also had the opportunity to attend the summit that you put together, and they sent, tremendous information, really good, just-in-time information that we need to have. So they were excited to have it, and then of course, since you all did such a good job, the expectation is a little bit better next time, and I told them he would be.
No kidding. Perfect. In addition to that, as you were not available last Thursday, and Commissioner Lucero, thank you for attending, but we did Mr. Green was in the audience, and unfortunately we don't have any of our COG folks on, but we did offer our World Elder Abuse Awareness Day at the Senior Center here in Trinidad. We had a lot of vendors, more than we anticipated, show up, which was a great thing, with a lot of good information for our senior citizens and their families. And so we had a great 3 hours, 4 hours worth of time to spend with our elderly population here. And they served lunch. Thank you to COG and their partnership on that. It was a really good event. So, and Ms. Ringo's team and the CMA teams for coming out and supporting it and doing a lot of the physical labor to get us up and running. And then also just a quick shout out to Mr. Grunkamp and Mr. Woodring with Road and Bridge. They came and helped us set up on the county side with tents and tables and transporting and cleanup. So I truly appreciate the whole county coming together to help us make that event possible. All right, I'll get into the heavy stuff now. Federal updates. I was in attendance at CCI last month. I was able to sit in on several federal updates that the state presented, and in your board packet I submitted a summation of federal updates that Larimer County, who's kind of monitoring these for us, is reviewing. And I don't know if you've had time to review those documents. As I mentioned, there's a lot of information in there. It's a pretty hefty packet. Again, I did get a federal update on SNAP today, which increases requirements as well, but I think the big topic discussion is really around Medicaid. And so just to generalize what those updates look like is the federal government in the, what they call the Big Beautiful Bill, is looking at about a $700 million cut to Medicaid, $700 billion cut to Medicaid over the next 10 years. What does that look like for counties? What that looks like is an increase in verification requirements. Right now, Medicaid is only required a renewal annually. They're looking to make that a 6-month renewal process. It has been that in the past, but with the current workload, then we're looking at doubling the workload for counties. In addition to that, I think one of the other major concerns that we have is that the feds are now looking at mandating a work requirement for Medicaid. And that is going to be a significantly difficult undertaking by both the state and counties to initiate something like that. In the federal updates at CCI, there was conversation that there were only 3 states that we are aware of as of today that have either tried or currently have implemented a work requirement for Medicaid. 2 of the states pulled back because it was almost physically impossible for them to issue that work requirement. What that work requirement looks like, if this bill passes with language that's in it now, is folks that obtain Medicaid services, and it's outside of our long-term service, long-term care Medicaid services. This is our other Medicaid programs that we offer, would be required to participate in anywhere upwards of 80 hours a month in either employment, volunteer work, or community service of some sort. And it has to be documented and filed with the renewal in order to maintain that Medicaid service. Part of the problem is they're changing the age range up to the age of 64 now instead of 59, which means that we're asking folks that are either retired and on Medicare that are also receiving Medicaid to now go back to work or to volunteer or to complete 80 hours of community service. In addition to that 80 hours, the SNAP benefits also have a work requirement associated of up to 80 hours, which means that they are not counted duly. So that means folks will be required to provide at least up to an additional 80 hours on top of the work requirement for Medicaid. That is a significant ask for our community. It's a significant ask for our folks that are currently retired and over that age of 59.
So clarify that once again, they have Medicaid and SNAP. Is that what?
We've got it.
I think we're muted.
Are we muted? We are muted. My apologies.
Thank you.
Thanks, Don.
So repeat that again, the last statement that you were talking about, where they are 64.
Right, so the Medicaid age range now for the proposed work requirement would have been up to 59. What the federal government is mandating is a change to that age range up to 64 years of age. So that would mean that anyone 64 or younger would have to meet that 80 hours of work requirement during Medicaid services. And that would be, again, outside of the federal mandate for work requirement on the SNAP benefits. So that's a significant lift for the state and for the counties to, one, develop a work requirement program, and also to implement that program and ensure that that program is adequately meeting the needs of what the federal mandate is. Again, a lot of this language is still it's still in draft form. We don't have finals, but these were the most current updates that we've received from our Fed partners regarding this. Primarily, this Medicaid ask or lift with the work requirement is to begin decreasing the Medicaid error rate or the fraud rate specifically associated with that. And what we mean by that is we traditionally have seen statewide that error rates are leading to either under issuance or over issuance of benefits, both in SNAP and Medicaid. And that comes from technicians either entering information incorrectly, or they're not getting the correct information from the client, or they're not getting that information at all. And so the verification of resources is much more difficult, and so therefore we're seeing that higher error rate because we're going based on what the interfaces we have with our CBMS system, also along with asking clients to bring those resources in. And so if a technician is not sure and they enter that information and then generate Medicaid for somebody who's not qualified, we now have an error rate. Or if we deny somebody because we don't have all the information and they should have been qualified, that's considered an error rate. The same with SNAP benefits, either an overissuance or an underissuance based on resources. For Colorado, under the Medicaid program, currently it is a 50-50 match. On $1, every dollar the state draws down from Medicaid, the state is mandated to put $1 to that. I believe there's talk about increasing that match on that end, but I do know on the SNAP end, they're proposing a increase because right now there is no state match to SNAP benefits, and that will also see a federal match requirement from the state. And I'll talk to numbers on that in just a minute because that's significant. As you'll see in the update, there's also the cost sharing requirement, requiring states to implement cost sharing changes or charges for individuals above the poverty line. And then there are additional Medicaid, you'll see the breakout of the 80 hours per month for work, education, community service, or a combination, or earning an income representing at least 80 hours of minimum wage per month. That's the requirements under the work piece. And again, that we would have to go through that 6-month redetermination process, and individuals would have 30 days to demonstrate that compliance.
So before you go into the next section, what do you think this whole thing with the proposed legislation, HR 1, that would impact the Medicaid? Is there any forecast to see what the population of enrolled Medicaid recipients is going to go up, is going to go down?
So right now, the state is projecting with the new work requirement and the requirement of a 6-month renewal rather than a year, we're looking at about another 187,000 Coloradoans becoming disenrolled in Medicaid services, which puts a massive strain on rural communities because, as we know in our community, the majority of folks, at least 2/3, are on some form of Medicaid supplemental services through our department. That is a huge impact to the state across, because if you also remember the PHE unwind after COVID, we also saw about 350,000 Coloradoans that became disenrolled.
Then my question is, even if the numbers were to decrease, what kind of administrative costs is that going to put on DHS across the state?
Well, across the state, countywide, part of the concern that I have is the 6-month renewal process, right? We're having a hard time keeping up with the annual renewals as it is with the workforce that we have. So we're essentially doubling the workload for the technicians that are doing that, which to me seems almost backwards because we're trying to avoid error rates, but my concern is, will we see error rates jump because of that request? there's going to be a lot of hidden costs that I think has not been assessed by the state and by counties yet as to what that impact will be. But I see that it will be substantially more difficult to process cases timely because of that ask. Because not everyone's on the same month renewal, and we have months that are heavier than others. So there might be a month where we're, significantly low in those renewals, and then the next month it would be double or triple the work because that month is when most people were enrolled in that 6-month time frame. This has not been fully assessed by the state or by counties yet, but this Medicaid lift will be a significant lift, and it will be very impactful also for our providers. One of the questions that I asked in the CCI update, which was based off of an assessment of the current language in the bill, currently when Medicaid is billed, you have a 90-day window from the date of service to enter that Medicaid billing into the system for payment, for reimbursement. So our hospitals, our doctor's offices, our dental, those all have specific timelines to enter that, so they have 90 days. In the new bill, it takes it from 90 days to 30 days. Some claims that get entered within that time frame are not paid out, and so my question to them was, does the bill address that concern as well? Because if a claim is entered in those 90 days but it's not paid, as long as that claim is rebilled every 30 days and the supporting documentation is provided, that claim can then be paid out. As case management agency, we bill directly to Medicaid for targeted case management services. Right now, we're on that 90-day time frame. If they drop that to a 30-day and we don't have an opportunity to resubmit that claim after the first 30 days, we may lose out on that claim payment, which means that we're starting to lose revenue for not being able to get that claim appropriately submitted to the system. It could be an impactful hit to a lot of our providers and the revenue streams with that reimbursement timeline.
So on the cost sharing, when we're looking at SNAP, who in the state, is that CBHS that's going to be putting a projection of the perhaps $30 million impact to the state on SNAP alone per year, and then on that, whatever amount of money comes to the state, it says here that requires a cost sharing between 5 and 25%. SNAP benefit could be based on the state's error payment rate, which that is a huge.
Correct. So according to the federal government, what they are putting in the bill right now is that all states will have an automatic 5% match or mandate of cost share, which we don't have right now. For the state of Colorado, that equates to about a $289 or $298 million line item, which we do not have. In addition to that, if you are above the 6% rate, and it varies based on the range, so if you're 6 to 10%, then the error rate would increase from 5 to 10% match. If it's
How is that calculated?
right, so that is based on both the either under issuance, because as they find those under issuance and they correct that in the system, because somebody didn't receive all other benefits, or if they were over issued benefits, as QC, as quality control is done, and we find those cases, that's how those error rates are calculated. It's based on, as we're reviewing those cases, then it's going to obviously create an error rate if we've done something incorrectly in the system. So as that error rate increases, it goes up in a scale. So again, beyond the 6% to 10, it's a 10% match. From 10 to 14%, I believe it's a 15% match. If you get above 20% on your error rate, then it's a 25% minimum match until that error rate is brought down. Colorado currently sits at just above 9%, so we would be in that 10%. So it would be closer to about $600 million in match required for the issuance of those benefits at this time statewide. And the counties, it has not been determined what that impact to counties would look like, but the counties would be responsible for a part of that percentage cost share based on the issuance of the SNAP benefits that were found in error.
Well, and then, this conversation we had at the meeting that I was there on Monday is what happens if or when the DHS at the national level is restructured, having 28 different, we have 28 different divisions, bringing those down to 15 nationwide. How does Colorado, where would we fall into? Are we not an independent region of our own? Or?
No, and there was, let me see if I can find that one piece this morning. As I mentioned, the SNAP sent a federal update this morning, and it listed out each of the states. This is not in your packet, but currently what we're seeing is, and you would be shocked with some of these numbers. So for instance, Alaska right now sits at a 60% error rate across the state.
60% cost sharing.
Yeah, right. Colorado, as I mentioned, looks like we've actually dropped below 9%. We're at 8.61. You've got states that are in the 20%, 35%, 22%. So those states would be at that maximum 25% cost share. And it does not, from my understanding, whether it's a state grant or a local control like we are with the counties, it would still be a mandate that the state has to meet regardless, and the counties that in a local control state like we are would be responsible for part of those errors. So I would assume the state would look at what is the error rate per county, because they can calculate that error rate per county, and those counties that have higher error rates would obviously pay a higher match proportion to what the state mandate would be. Just some other health and human service concerns that we're monitoring in the bill. There's a 25% reduction to the HHS budget. They are looking to eliminate the following programs. Low-income home energy assistance program, or as we know it, LEAP, would be discontinued altogether. They are looking to discontinue the community services block grant, CSBG, the refugee social services, and the Title X senior community service employment program. They are looking to strike all of those programs 100%, and we would not offer those within our communities anymore.
Well, the question that I asked, and everyone seemed to, the DHS director, by the way, such an amazing work that was done at the conference, and I happened to, one of the relevant questions that I really am interested in finding out is, what is the services that Colorado provides? What are the mandated programs by via statute and or approved by the General Assembly? So the DHS directors will go back. I had an opportunity to speak to several of the large county DHS directors, and that's one of the things that I mentioned to them is let's get together, meaning you all, the directors, get together and find out what are the mandates that we have that we must meet, because Colorado has been leading in the DHS world, the nation, to provide more services than possibly even mandated when the money was there. But now that the money could be reduced and or dry up, what do we do as counties? And one of the sad things for us, it's going to put a lot of pressure on counties to assess. Now what? So it was a tremendous. That Monday I was there from about 12:30 till we were done with that Monday. The entire afternoon was based on this, and then of course I was looking forward to the Wednesday, which I happened to be at the Southeastern meeting. But thank you for the update.
Yeah, I think some other high-level stuff to look at is there is a federal funding increase to the Care and Share program, which is commodities. So they are looking to increase that funding. To date, we don't have any language in the bill that speaks to cuts on the long-term care Medicaid side. So that's one beneficial piece so far, that we haven't seen anything. We do have concerns regarding reduction in childcare funding across. As we know, CCAP is in a dire strait in this community, but federally they're looking at cutting between 40 and 50% a reduction in staff in the offices of Head Start and the Office of Child Care. So we would see additional mandates at the federal level with less staff. And then the other one, I know our health department has been hit pretty decent already with federal cuts, and I think one of the biggest one in this bill that's scary is that the 26 budget indicates at least a 2/3 reduction in WIC cash value benefits for fruits and vegetables programs. So our WIC program would see a significant decrease in funding for the mothers and children that benefit from that program. So these are major federal cuts that are proposed. Again, it is all in draft at this point. I know that the July 4th deadline that they're looking to have on this, I don't know if that will be met. I will say that this morning we were also given an update that a letter from Governor Polis's office, along with all of our congressional district representatives and state house representatives, sent a letter to the federal government regarding the Medicaid and the SNAP benefit mandates that the feds are proposing in opposition. So that letter of communication did go out just this week, so we've not heard anything more on that. But those are kind of the very high-level overview of Medicaid and SNAP and some of the other programs. So if there are other questions, I'd be glad to answer those.
No, and by the way, you're absolutely correct. The document that we have, it was just plain with clicking on all the right links and going to the various federal sites, citing law and statute, and so keep translating it for us as the process advances. I know the congressional delegation at the national level, they're hoping to have action before July 4th. So we'll see what happens once it's there and how long it's going to take to have this whole thing. Basically, for us at the county level, how do we navigate these challenges? And then, of course, what you all, the directors, do. It's incredible, but I know there is enough talent and knowledge in there to identify what are the services that we are mandated to provide. That's going to be tough. Yeah. That's really going to be hard.
In addition, Commissioners, in your packet, and I'm not sure if Finance Director Coberly went over it, but I did include a copy of the MGT annual county cost-wide allocation plan that was completed. I know she usually goes over that with you all.
She just recently gave it to me for review. It should be in the next meeting.
Okay. And then additional, the last section, one of the things that I want to provide you with is just a quick overview of the decertification for caseworkers review process that the state has now put forward. What this is that when we have caseworkers throughout the state of Colorado who have unfortunately been terminated from employment with another human service organization, and primarily due to falsification of records, the state did not have a process for decertifying that caseworker, which meant that a caseworker could go to another county and then be employed through another agency in order to continue their casework service. There was major concern with that because we've seen a lot of falsification of records across the state in the last few years, and so the state and county directors and child welfare staff leadership have met to talk about a decertification process. They're looking at the same thing for adult protective services, and these will both look at different scenarios in which a caseworker is terminated from employment and what that termination then requires the county DHS offices to do in order to decertify that individual at the state level to ensure that we're not putting them into another situation where families and counties can be harmed due to their case management practice. And so that's just some high-level overview. There's only a few slides, but it quickly just gives you an a quick eye and earshot of what that decertification looks like.
So once the decertification goes on, I would imagine it's going to be a release for all the DHS.
Correct. So what we normally do now is we have to, we will have to submit a request for a provisional. Even if they are certified through another county, we currently do the practice of verifying that they were already certified through training and that there were no concerns. The problem is because it deals with personnel, we, county to county, cannot discuss termination requirements, and so they're not required to disclose that, obviously. We can ask that, but they're not required to disclose it. But as we hire individuals, our department has always met the mandate of child welfare case managers or case workers required to do fingerprinting in both FBI and CBI background checks. In 2022, APS went to the same platform. Prior was just CBI. We now are required to do FBI background checks on all case workers in both APS and CPS. And we also do a pre-employment background check through CBI before we even offer a position. So we are trying to capture as much as possible up front any concerns. We will also reach out directly to the state to see if they've indicated that they've been certified in another county, that that certification is still valid, or if it's outdated, and what the requirements to get them back on board would be. In that time frame is when we would understand whether or not a decertification is taking place for that case worker. Other than that, commissioners, I have nothing else to.
Well, I was just wondering how, if in July, I think you had mentioned, because everything's in the draft, how are you supposed to prepare your budget for 2026 as far as staffing goes, if you're not gonna, even if they don't meet the July 4th deadline?
Well, that's part of the difficulty with human services, especially because when we budget for human services, we, as far as the local tax revenues or the assessed valuation, it's based on a calendar year, so January to December. When we budget for the programs that we offer that are on a fiscal year, each of those fiscal years are different. So most are July to June. Some start in September, end of September, start in October. We have some unique dates. The problem is that when we budget for the next year, so for instance, when we budget for 2026 for you all to approve that budget, we will have already exhausted a half of the federal fiscal year prior on the contracts for the programs offered. And so what we try to do is budget to the allocated amount and meet that match, because when we under budget to what the state gives us an allocation, the state starts to pull that allocation back down. And so we try to budget as much as possible to the full allocation so that we don't lose that funding and spend that funding. When we don't is when the state pulls it and gives it to other counties that are overspent, and that becomes an issue. We want to try and budget as closely as possible to the full allocation amount, and that would also we don't go over as much as possible. We have other ways to recoup that through incentive funding that we are required under contract to meet in both our economic security team and also within our child support team. That helps offset a lot of the cost. And as Deputy Director Eklund has gotten a crash course in DHS finances over the last 6 to 7 months, it's a budgeting challenge every year. Because what we try to do is ensure that we budget enough, but also that we are able to put a cushion, because there are years where we will be underspent in certain allocations, we will be overspent. In this year, we will be overspent in certain areas that we've never been overspent before. So we will have to make sure that we are able to buffer that overage as much as possible without having to hit the county general fund, because if DHS does not have a fund balance and we cannot pull from there, then the county general fund is required to cover those costs based on the state and county contracts.
What a fun day to have three different types of.
I've told every person that I've done at meetings in the last 5 years, I am the Debbie Downer of every meeting. I'm sorry, but it's just the way it is.
It's reality.
It is.
So I know you made a comment on the cost allocation plan, or what was that?
Yes, county cost, right?
Okay. And and that's going to be at the next, we have some documents here by our brothers, since Commissioner Tony has them here. We will address those there. Let's now go to anything else,
I'm not at this time.
Thank you. We don't have anything on section 5, or we're going to go to 6. Consideration of case load, counseling activity by program. Ms. Bringo, good afternoon. How are you?
Good, how are you?
Doing well, thank you.
Good.
Great to see you.
Do you have any questions on case counts for CMA or for APS?
I don't usually.
I don't know.
Okay. Today what I thought I would talk about is a little bit about what we do at the end of the fiscal year. We have many reports that we're required to complete at this time of year. One report that we've completed in the past week, we do monthly. And the state has asked us to do what they call a case management stabilization monthly data form. And this is the state's way through healthcare policy and financing to monitor how the case management agencies are doing with all the changes that they have thrown our way. There's been an incredible amount of change in the past year or two. And so they're monitoring, they're asking us, how many overdue assessments do we have? How many overdue case plans do we have? How many monthly contacts have we missed with clients? So they're just trying to gauge what's going on with the case management agency. I thought it was interesting that in a meeting I sat in last week, one of the directors of developmental pathways, one of the case management agencies, noted that 80% of their staff has only been with them for 3 years or less. And the Resource Exchange, another case management agency, said only 50% of our staff have been with us 2 years or less. Because of the changes, it's created a lot of turnover in staff, it's requiring a lot of training, and so that just demonstrates what's going on in case management agencies across the state. That brings me to another report that we have to fill out twice a year, and I just filled this out last week, is the CMA training report. They require us to do training in 19 areas, and so we do that, but also because of the addition of new programs and changes in existing programs, we probably have had 6 program area changes where we've had at least 3 trainings to each of those program areas, and the state mandates them and monitors for them. Another report that we have to complete, because the state's also looking for accountability and quality service, is we have to fill out a complaints deliverable. So we have to cite all the complaints that we're getting from clients and look at what is the origin of those complaints and were they resolved and how were they resolved. Unfortunately, I think a lot of this is due to issues with our systems and sometimes the breakdown in communication where we can't get back to clients quickly enough because we're having a system issue and we need the state to fix it. So we have that report. The last report under CMA is our Community Advisory Committee. We have to report to the state that we have quarterly meetings. They want to know what the content of those meetings are. They really want us to be discussing complaints and looking at accountability in those meetings. And it's interesting because community providers, our partners, like those meetings just the way that they are. But the state is dictating a different vision. So I'm probably going to do a subcommittee of that committee to meet the criteria that the state wants us to look at, and then try to honor our partners and providers' wishes by keeping our committee as it is. In adult protection, my other side of the house, we also too are ending the fiscal year. We have to show that staff meet training requirements. A full-time APS caseworker has to go through 40 hours of training per year, and it has to be documented and approved by the Department of Human Services. I, as a part-time supervisor for that program, have to do 20 hours. We have to go in and make sure our adult protection teams are meeting and the data in the system is correct. So we have to make sure we have all our members, they have their confidentiality agreements all intact, and that we're meeting the requirements of the Statement Act. Another thing that we have to do is that we have to do 5 outreaches and trainings per year. And that's another reason that we do the fair, other than trying to educate our seniors. But it's a way to outreach and to remind seniors of the fact that there is abuse, neglect, exploitation, and scammers out there. So we've done 4 of those so far. We need to do 1 more by June 30th. And the last thing I need to work on is we do cooperative agreements. And that is an agreement between social services and law enforcement. Sorry. And the DA's office and our county attorney. And it's basically a document, and it's a template that the state gives us for us to discuss with our partners on how we're going to conduct adult protection investigations, how they can contact us, how we're going to do a joint investigation, is it going to be a single investigation, how is that going to come together, and what's the sharing of information going to look like. We also do one with the Community Center Board, because unfortunately, from time to time, there may be an investigation needed in one of the group homes. How is their staff going to investigate versus our staff? And the last one is with the ombudsman. Unfortunately, in nursing homes or assisted living, from time to time, there's also concerns there. And again, how are they going to look at it versus how is adult protection going to look at it? So right now, that's what we're working on in June, and hopefully we'll have all this done by June 30th. So.
Well, I have no doubt you'll be doing this, and congratulations, and thank you for doing all this. How does the San Luis County compare to when the small counties our size, when it comes to meeting all these requirements you were talking about, all these different criteria that you have to meet? And that's going to be a challenge.
I think we're doing well because we don't hear anything back about that. With the monthly stabilization data, that we do meet with healthcare policy and financing officials once a month. That meeting's coming up in a week, and they will ask us how we're doing, and they really try to keep that each per case management agency. But yeah, I think we're like the other CMAs.
I think to add to that though, and what Lori's speaking to is her side of it, and I don't know if Marcy Mason's online, I believe she is, but Marcy also, we are under contractual agreement with the state when we renew our CMA, as you know, the single entry point prior SEP, and we onboarded the CCB waivers and services. Marcy has just as many, if not more, deliverables as well with the IDD population and the state general fund programming that we're required to meet as well. So we've got 2 supervisors who are doing a ton of administrative level reporting to the state. That takes a ton of time, and that is the contractual requirements. We've gone through 5 amendments on that contract since last June, or July 1 when we started. We just signed the contractual amendment, which we have no choice but to accept that amendment because we're already in the original contract. It doesn't change anything per se, but what it does do is it increases the number of deliverables required in order to meet the contractual agreements. And primarily, it seems like we were talking about the Community Advisory Council. On Marcy's side, we also have the Human Rights Committee, the HRC, which you all approved those members to serve on that board. That Human Rights also has mandates that require us to report any concerns where a client who is on long-term care services feels that they have had their human rights violated in some capacity, and that committee has to review those concerns, and then there's reports and other mandates that are required to be met. So this is not an easy program to navigate, and when you ask about whether or not how do we kind of pair up to others, Lori's correct. I don't get a lot of negative feedback from our state partners. In what we do here are areas that we can improve, but it's nothing that says that we're in in a position where we have to look at a turnaround plan. I know several CMEs that are currently on turnaround plans throughout the state under the new contract, meaning that they couldn't meet the requirements of the case management, they couldn't meet the requirements of the deliverables. And that's unfortunate because those CMAs have been tasked with just as much. And some of those CMAs are substantially larger than we are, and they can't meet that mandate with hundreds of staff. And, we're a staff of about 20 total for what we do. So it's a significant lift to ask in this program.
Well, thank you.
Welcome.
Great work.
Thank you. That's great.
Marcy, were you on? Did you have anything you wanted to add?
A good overview of all of the deliverables. There's so many, and they keep adding additional ones every year, and some we have to do manually because the system isn't working properly. Manual tracking and reports properly, so, but everything that Laurie went over is except for the APS information. We do all same complaints. We have real list on the USDB program, so we have approximately 3 small reports that we have to track manually and turn those in every month so that individuals who want to be in that program can be enrolled if they so desire. So that's a statewide list. So we have to do tracking on that also. And balance support council and human rights committee council like Michael's talking about. It's just a lot of administrative work. Every month before we use it. And I think that one.
Thanks, Marcy. I think one other thing to point out, commissioners, starting July 1, and there's a lot of buzz throughout the communities around a new platform that the state has released. It's called Community First Choice, CFC, is what you'll hear it as. CFC changes many of the types of services and how we effectively render those services through long-term care. What it does is it gives the individual receiving the long-term care services specific opportunities to really guide and dictate their service providers even more than we already do. Right now, everyone has the choice to request their provider. The concerns that we have with that is that there's a lot of miscommunication around when those CFC services can be implemented for individuals who are currently on that, unless there's a specific medical reason why a significant change that would require it. But otherwise, we will roll through the next year to get folks onto CFC as they come up on their renewal dates, and then we will assess them at that time. But I think it's important to understand that these changes are not small changes. These are changes that will require our case managers and our administrative staff to really change how we do our business functions and processes now to meet the new mandate of the CFC requirements. We will basically, and what we've done in the last 2.5 years that we've been in transition is completely overhaul our business practice multiple times to try and meet the mandates. This is not a program that is a quick turnover and change and make these are huge lifts that we're asked to do as part of this contract, and many CMAs are in very unfavorable positions with the states. At CCI, several HICPUF members made comments about the CMAs and concerns that they've had. So I think for us as a CMA, this team has been amazing at bending and swaying with the asks, but we're also entitled to push back on certain things because we can't meet all those mandates all the time. We also have sub-recipient awards to Warfield County, the DHS staff up there, and their health agent services are subcontractors to us. They provide those services. Marcy's team provides services to both counties from here. So it's a very delicate balance of how we do the business processes, and when we're asked to change them completely, it upsets the balance. And so we anticipate we'll have some local clients who are probably not as pleased with the CSE transition over the next year, but this team's done amazing to try and triage it as best as they can. So I have to commend them for that. So thank you to Marcy and Lori and Hallie in Northfield County and Sean Grosso, our lead who oversees our case managers for the CBS side. So thank you to all of them. And I think another one that needs to be pointed out is Joanne Carby. She's really stepped up on the CCB side to bring in and incorporate those waiver services and really helping to lead with Marcy, that team, to keep those IDD waivers and that state general fund programming going. So thank you to them. It's been a big lift for them. They not only had to leave an agency that they had been with for 10 plus years or more, but to transition to us, learn our processes, and incorporate these services with all the changes as well.
Great team and well-oiled machines. So, anybody else on that you want on these under the caseload counts?
I'll look to Ms. Tucker. Did you have anything to update?
I don't really, but I have a meeting I have to get to that
Okay.
Ms. Nelson is mandating that I attend.
Okay.
She's texting her like, what are you still doing here?
She is a taskmaster.
She is.
I really don't have much other than Safe Babies. We're working on getting that up and going. We applied for a transportation grant as well as still working on that mobile OMAT, and we applied for funds to start up a Caring Dads program, and my two male staff, Nick and Phil, are going to head that up, and so we're going to get them trained to do that in September.
Tell me a little more about the transportation grant.
So transportation grant, we already spend a lot of our special, I guess I'm not a book, and then I got all right, we already spend a lot of our special economic assistance money to provide transportation to families to attend family time, to attend services out of town, those sorts of things. And so I applied for a $4,000 grant to help with that transportation. I also asked for some money to help with mothers who have drug-exposed babies in NICU, to help with transportation for Ubers and Lyfts and bus tickets and Pueblo, the bus staying, those kinds of things, so that they can continue to be connected with their babies and that kind of stuff. So I haven't heard back about that one, but we did get the money for the Caring Dads. So we're very good. So
Congrats. Thank you, right. And council is giving me that's enough.
Yeah, she's
Commissioner,
like,
let her go.
Walk
really important meeting.
Walk fast, but don't run.
Unnoted.
That's my old teacher garb. Okay, walk fast, don't run. Ms. Christie, anything on child support you wanted to update on?
No.
Okay. I know our therapeutic services, I don't have any updates. And then I know Ms. Garrison's online. Ms. Garrison, did you have anything you wanted to update the board on today?
It's been in a hurry, no, but actually I did have something prepared.
We're never in a
Because
hurry.
there is a program that a lot of people really don't know about, that I feel like we really need to get the word out on this program. And it will take up maybe 5 minutes.
Okay.
No,
I can talk fast.
do not worry about time. You go ahead and present your information, and thank you for being here.
Okay. So the program I want to bring forth today is the Health First Colorado Buy-In Program for Working Adults. The Health First Colorado Buy-In Program for Working Adults with Disabilities allows adults with qualifying disabilities to buy into Health First Colorado Medicaid program by paying a monthly premium, even if their income or assets exceed the limits for other Medicaid programs. This program is designed for those who are employed and need health coverage but may not qualify for other Medicaid options due to income or asset levels. Many people with disabilities worry that if they start to work and earn more money, they will lose their Health First Colorado Medicaid coverage. The Health First Colorado Buy-In Program for Working Adults with Disabilities means that you don't have to be afraid. To qualify, individuals must be between 16 and 64 years old, a U.S. citizen or qualifying non-citizen with a qualifying disability, as defined by Social Security for the state disability determination vendor, and be employed. Income is a key factor, but the program allows higher income levels than other Medicaid programs. Disregards are applied to income, meaning not all of a person's income is counted toward the eligibility limit. For example, half of the income earned is disregarded. Eligible individuals pay a monthly premium which is based on the sliding scale and their individual gross income after applicable disregards. The program provides access to a wide range of Health First Colorado benefits, including primary care doctor visits, medical equipment, home care services, mental health services, dental services, emergency services, transportation, and more. If an individual is not already receiving Social Security disability benefits, the state will determine if their disability qualifies them for the program. An ART will be completed by the individual and submitted to the state disability vendor. This process, however, can take up to 90 days as medical records are needed. There is no resource limit for this program, meaning individuals can have significant savings or assets and still qualify. So how it works is, first you apply, they need to complete the Health First Colorado application to determine their eligibility for the buy-in program. Disability determination, if not already receiving disability benefits, the state will assess the individual's disability. Income assessment, the program considers income applying disregards to earned income and assesses the premium based on the individual's income after disregards. The premium payment, if eligible, the individual will pay a monthly premium, which may be $0 to $200 depending on their income. Coverage. Once enrolled, the individual will receive a Health First Colorado card with benefits, including access to health care services. So many individuals in our county are working individuals that find out that they have some type of cancer or other disability type sicknesses or illnesses, and immediately they feel like their employer's insurance isn't going to cover all their benefits, they're going to have problems, they're going to lose their job, they're going to lose sometimes their homes, and they panic. But this program is one that we really, really need people to understand. Come to us, ask the question, let us help you. Don't be afraid to come and apply for this program. This program will help many, many individuals that are actually working and want to continue to keep their job, and their insurance sometimes will not cover everything they need. So that's the program I really wanted to bring to light today. We really need to get the word out on this program, and we hope people understand not all programs are just for those that don't have income or low income. We actually have this program that people can actually utilize, and I wish they would do that. And that's all I have for today.
Well,
Any questions?
Yes, a couple of questions. Thank you for that information. So, if an individual from San Luis County is seeking specialized care, once they become, once they're accepted into Health First Colorado, and they have the card, and the treatment that they're seeking is outside of the San Luis County, you mentioned that there is opportunity for transportation costs. Did I understand that correctly?
Correct.
Wow.
Actually, what it is, it's actually, they will be eligible for your med run. So if they don't have family members that can take them to their appointments, or they don't have family members, they are eligible to take any type of medical ride or use any medical provider. They will take them back and forth to their appointments.
You know, I know you have some spare time, and so I think what about putting some information for community members? I hadn't heard about this particular program, because I think the attractive portion of this program is the monthly premiums. Sounds like
Correct.
Income is not really that big of a factor, but if the need is there, I don't know if you have one white paper, one pager that we can distribute. I mean, we have, if you send it to us, we definitely will be able to send it out and help promote this program. And then my deal, I guess another question, how is this funded? Who's sponsoring this?
So this is strictly,
Yes.
oh, go ahead.
It is Medicaid. It is a Medicaid program.
So then, thank you, I have clarification. What happens once, if or when Medicaid reductions go into place?
Well, in this instance, this case already, or this program already requires that they're working adults. So the mandate would most likely already be met in regards to the new work requirement piece. I think it's also important to point out that this is the adult side. We also have a children's buy-in process, so that families that have children with qualifying disabilities who are working, but again, they need transportation services, they need additional types of services that their insurance won't cover. This buy-in option is available for them as well. We see a lot of families with youth that are diagnosed IDD or classified IDD utilizing these types of buy-in services because this offers parents respite, transportation, kind of all the things, mental health, those types of things that they wouldn't normally qualify under their current health plan.
Well, great information.
I will get you that information, and hopefully come up with, I would share the calculation as far as how they get the premiums calculated, because it's really interesting as far as they don't use dollar for dollar, and the disregard is a huge disregard, which makes quite a bit of the individuals eligible. And the premium is smaller than a premium you would pay for a regular insurance premium, which that's what I really think people really need to know about this program. The insurance premiums we know by private insurance companies are really high, and the most this part of it will charge is $200, but that would be a really, really high income. So it's really enlightening to know that there are other programs out there other than just private insurance for those that really, really need it.
Thank you.
Teresa, I have one quick follow-up on that, and I'm not clear on this either. We have folks that are obviously beyond the age of 65 who are still working in this day and age, but are on Medicare. Is ABODs available to them that are on Medicare as well?
No, once you reach age 64, once Medicare kicks in, you no longer qualify.
Okay, thanks. I just wanted to make that clarified.
Anything else under the case law counts, Mr. Erwin?
Not at this time, Commissioners.
All right, so Commissioner Lucero, I'm going to motion to approve the case law counts and activity by program June and July.
I'll second that.
Commissioner Lopez?
Yes.
Commissioner Lucero?
Yes.
Thank you. We're going to go now to 6B, consideration of 21 IHGA 168-843 Equifax work number contract. Mr. Paragon.
Commissioners, we're getting into that season of contract requirements again. This is the work number requirement, and in past years I've discussed the concerns with the rising costs of work number. Work number is one of the interfaces we use through Equifax for determining employment verification. This specific piece, the only reason that I have moved forward with it this year is that the state contractual was the per hit rate. So every time a technician uses this to identify and verify employment as an interface, we get charged a dollar amount for each time. The cost in the last few years has significantly increased as high as up to 19% each year. This year, however, because of an issue at the state level with Equifax last year on the contract, they received I believe it was either a $2 or $3 million credit, which took the cost almost in half of what, more than half of what we would have paid for this year. So contractually, this year it makes sense to maintain this, and most of the counties are doing this, but as I've mentioned in prior years, what I'm looking at is potentially contracting either with these folks independently, as we know there is a county that I will not name, but they are on their own contract with Equifax, and the rates are substantially less than what the state contract is. And I believe it's based on what the state entered into the contract with Equifax way back when, probably 20, 30 years ago. So this contract is in front of you today. This is to allow us to move forward. As you'll see for fiscal year 26, which is what we're approving, is the $39,085.45 That's the estimate for us as a contractual to pay based on the current usage of this prior year. Again, this is at a 50% discounted rate because of that credit that the state receives. So realistically, we would be paying closer to $80,000 had they not had that credit this year.
And I guess you've already line item that dollar amount.
Yes.
And council has had an opportunity to read the contract and
I have no reasons.
Commissioner Lucero, any questions?
No questions.
Hearing no questions, I will entertain a motion.
I will move to approve 21 HGA 168-843, the OFAC support program contract.
Second motion.
Commissioner Lucero.
Yes.
Commissioner Lopez.
Yes. 6C, consideration memorandum of understanding with Illuminate, parentheses, Safe Babies Court program, and I think that's what council was kind of hurry up and we'll take care of that. Mr. Erdogan?
Council looks like she's got something to add.
All right.
Oh.
No, so that was, I'm setting her up on something different, but, do you want to talk about safety?
Yeah, so, well, actually, you probably have more insight on it than I do at this point.
So, when we have to remove a child from the age of 0 to 3 years, it's a very difficult time for these kids. That's when they're attaching to their body. It's important for us to have services for all kids, all ages. But this is a very critical age for our children. And we've been seeing a lot of repeats, in fact, I have a case right now, 2 separate cases. The babies are 18 months apart and they're really positive for substances. Despite all of the services that we've been trying to put in place for mom or between outlet for these kids or for these parents, we've been unsuccessful. Safe Baby Support has found some success in it, and it's just a specific program that is dedicated to keeping children with parents. Sometimes we can send them to a facility where the child can go with them and they can get over to that facility and have that bond with the child and keep the child safe and there's eyes on the child. Sometimes it's services outside of the home and then in return. But as we always know, in Los Angeles County, a big problem for us is services. We don't have the services, we can't find the services, we don't know where to get them from. This program gives us someone who is working with us on our behalf to locate those services, to help us get those services in place. So it's just another resource that we can use, and it's also, it's through the DNA Court, it's still a program, but it still allows a little bit more focus, a little bit more time on these cases, with more outside resources coming in. The MOU, they put this in place because they don't want to do the program unless there's really buy-in. And it's a collaborative, we have to bring everybody in, especially the judicial side of it. So they do the MOU to make sure that everybody is truly committed to buying in and actually helping the program to be successful. I'm very excited for this program. I'm ready to have it start as soon as possible. So once we have this in place, I'm pretty sure judicial is not giving us any issues anymore. We can get the ground running and hopefully have a different outcome for a lot of these kiddos that we've been.
Now, we've already had an initial meeting with Illuminate to discuss where Los Angeles County sits. We have, in a much shorter time than I think most counties, met all the mandates for Safe Baby Court to be implemented within our community. We're, according to Ms. Tupper in our youth and family services, I believe she's shooting for full implementation by January 26th. But as you heard, she's already been able to obtain grant funding for certain things. We're seeking additional. These are the types of funding and resources that we can leverage through Safe Baby Court. So although we're not 100% on, the Illuminate agency is already identified Los Angeles County as the next Safe Baby Court county. So we're already able to start accessing some of these resources that we haven't had. And legal counsel is correct. I mean, this takes on collaboration from not just us and Illuminate. This takes on requests from the courts as far as GALs, RPCs, all of those individuals that impact a DNN case that we manage through Department of Human Services. And I know Honorable Judge McKisson is a huge Illuminate supporter. As we heard at the opioid conference where he discussed with Illuminate, who was there to present, the impact of this. So this is a strong partnership that we haven't had in the community, and we need to. So in front of you is an MOU agreement dictating those partnership requirements from each of the agencies.
And as the third judicial is Huerfano County as well as in this.
Correct. Huerfano County's already been a safe baby court county for probably about a year and a half, maybe more. And so we're now at that point where we're ready to start this program.
Well, I thank you, Council, for doing all the legwork and doing a lot of that. That's incredible what you're all doing on this field. Commissioner, sorry, you have any questions?
No questions.
I will entertain a motion.
I will move to approve the MOU with the Safe Baby Court Program.
I second that motion.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes. Thank you. I'll go to section 7, financial matters, consideration of financials and bills for April 2025. Finance Director, good afternoon, how are you?
I'm good, how are you?
I know Mr. Aragon says deputy. I'm just going to forego the deputy word. Okay, please.
In your packet, you'll see we have two of the treasurer's reconciliations, one for March and one for April. The March reconciliations included this month, last month's was